I remember the first day I cried when I met a volunteer here. I cried out and it was like comforting me, life will change and we'll be in this together. I can have my life back.
George House Trust's vision is for all people living with HIV in the North West to live happy and healthy lives and be free from stigma and discrimination. George House Trust's vision is for all people to know their HIV status and to be HIV aware.
We are about 5 or 10 minutes from Piccadilly Station now on the bus. So it's just a bit south of the city centre in Ardwick, just near the Apollo. I do health and information sessions. You work around sex and relationships, disclosure, which is an important thing for people's, sort of managing their HIV in terms of who do I tell, when do I tell, should I tell.
We provide support around the most important thing, adherence to medication, and also try to manage the side effect, and also try to encourage them to discuss with their consultant if there is any issue.
People can be given information at hospital, but actually they need time and space to digest and process what it means for them to live well and live a long life with HIV. But also what we offer is very bespoke. We're ensuring that we're confidential, that if somebody doesn't want to meet another positive person for the time being, that's fine. Entering a relationship and disclosure might be a massive step. We're there for all those big life events.
This is the first point that service users would arrive at when they come for appointments or if they're coming here for any service. And so these are the one-to-one appointment rooms that are used for advisor appointments, anything that needs that one-to-one space.
A lot of people living with HIV, they don't disclose to their families and friends outside. So this is the only space really they can talk about HIV. We've got peer support volunteers on coffee mornings as well, who helps people who are new, who are coming for the first time.
It's where everything happens. We've got a reception volunteer over there, service advisors down here.
People can access what we call emergency payments. So if somebody's run out of food, there's another part to it where people can apply to get a bill paid, or they can apply for an item of furniture or white good, and that does a lot to alleviate poverty.
My knowledge about HIV just sort of like expanded 100 times fold with the information sessions that I actually came to.
I am being supported by George House Trust. Without them, I don't think I would have managed to live life.
George House Trust offers people a place to feel safe, to feel that they're not alone. Do I tell my family? Do I tell my friends? Do I tell the people I work with? All of these things can have an impact on people at the beginning.
Without this organisation, they'll be left alone, and what would happen to them? You just don't wonder how people might cope.
People can feel exceptionally isolated. People think they're the only person in that situation that they're in.
There are certain elements of the service that we don't or cannot provide in the NHS. These voids are filled by George House Trust. Patients do find it very useful to talk to other patients, which they cannot in NHS clinic. You are the patient's voice.
While I can talk to patients in clinic about medical things, they're not really there to provide support around social issues, as well as money immigration. It can be things like social isolation, for example, and how someone manages their health and peer support and that sort of thing.
Whatever happens at the George House Trust stays at the George House Trust. Some people are scared of going to doctors and opening up to medical practitioners. They don't know who's going to be there, they don't know who's going to talk about them. It's a confidential environment.
When I come here, I meet other people. It gave me hope and strength. I became more and more strong.
We can say that HIV is a long-term manageable condition. The doctors will say exactly the same thing, to almost the point where people hear it but they don't believe it. Coming to George House Trust, they can see that happening.
It is a completely life-changing scenario. That was it, now I'm HIV positive, I'm never not going to be HIV positive. It was something that I pretty much dealt with there and then. I just then had to deal with it on behalf of other people straight away as well.
I sort of, hating life, and I stopped making any plans for the future because all what I'm waiting for now is to die.
People still think, am I going to die? And it sounds really serious, but people do think that. Even though HIV, as we know, is a long-term manageable condition now, we have trained volunteers who can meet with people, speak to people about their experiences, and they can work through their issues. Do they understand the issues around safer sex and how they may still need to think about other sexually transmitted infections even though they've been diagnosed with HIV. So there's loads of issues that we can work with people about.
African men have got quite a lot of issues, not just being HIV positive, but this is the stress of living with HIV, the stress of being, in the asylum system, being here at George House Trust, and where they can talk about almost anything, and also without holding back about their HIV status. It makes them feel at home, away from home.
Instead of prioritising health, what they do is prioritise money worries. The stress of not having enough to live on can mean that maybe not adhere to medication, miss hospital appointments.
I think the most important thing that we need to do, particularly early on, is tailor it to the individual, because everybody is going to deal with it completely differently.
If we prevent the one HIV positive person from onwardly transmitting HIV, which we know we can do through good adherence to medication, we save the public purse, and this is a conservative estimate, £250,000. There's a big return on investment there. There's a public benefit to the work that we do that is really impactful.
Well, the Welfare Fund, it comes from fundraising. We get some donation from Manchester Pride. So George House Trust does a lot of events and activities throughout the year to try and raise money that we can put into that pot.
If the services and facilities provided by George House Trust were not there, and other voluntary agencies, then I would find it very difficult to fill that void. Not having them in these financial straitened times, I feel all of us have to tighten our belt, and funding will be difficult.
I think there's a need for specialist service because it is so complex. You need to have a lot of knowledge to help someone living with HIV because they often present with really complex issues all at once.
George House Trust needs support because of the vast work which they are doing, helping people. But even those who are affected, and George House Trust, goes far to help these people.
They are trying to deal with HIV in itself, and also trying to deal with how to hide it from their family. And because they're not telling, they don't have that support. So I think stigma and discrimination together with disclosing, it's a big issue with people living with HIV.
It's just the fear of thinking that they're HIV positive, that their life is over. The world is just finished for them, there's no more life. You try and work hard and pick that person up and say, there's still life. There's medication nowadays, so, people are not dying anymore of HIV.
I just thought, now this is the end of me. Though the doctors tried to comfort me, but it didn't work. If somebody knows that I am HIV positive, it means I have low morals.
Now, I've been really, really lucky. I know people that have been completely shut out by family, friends, loved ones, colleagues, everything. It does happen.
I think people do discriminate because they don't have the actual facts. People have got a view of HIV in the 80s, which is totally different from HIV now. Sometimes HIV just takes all your confidence away. So that advocacy that the advisors do, that the sessions do, it actually helps for people to improve their lives and start living again.
I have to recognise it is much more difficult for some people who may be on the margins of society anyway, even before you bring HIV into it. So how has that impacted on their health and well-being and their ability to plan for the future? And we can help with all of those things.
We want every positive person living in the northwest of England to know that we exist. There can be some really detailed information somebody might need about disclosure at work or about treatment as prevention. Somebody might need some support when they're newly diagnosed. Somebody might need some support when they have to start going on medication. But I would really encourage everybody living with HIV to at least have some contact with us to know what support we offer, and we're there when they need us.
We have very good working relationships with the main HIV clinics in Greater Manchester, and that's something that's very important, because what we can't do is replace the doctor, in that we can't give medical advice. We have to have that link with the doctors to make sure that if necessary we can support people, advocate for people with their HIV doctor.
We value the human touch, I feel. When I have certain problems that I cannot solve, I can pick up the phone, speak to one of your counsellors or one of your staff members. Following that, advice about finances and things like that, which we cannot provide. Yeah. I cannot manage my own finances, let alone patients' finances. So it is very important these kind of links are robust, and understanding what each other does very well is very important.
I know quite a number of guys who, when I started working here, they never had even confidence of trying to put an application to look for work, because they felt, you know, how will they cope with HIV? Will they get sick, and what will their employer say? And giving them that confidence, they've gone back to apply for jobs. They're now back in work. If you see them today, the smiles are so huge, you'd be surprised.
I accumulated some debts, and I was able to access services here where someone was able to actually help me compartmentalise these debts and actually deal with them. These were things that were just like overwhelming for me at the time.
Sometimes when you sort somebody's debts out, you can actually see a massive change in somebody. A lot of what we do perhaps is not noticeable, but I think the effect that we have on individuals is massive.
Sometimes you just talk to people on the phone, they don't even want to come to the building because they don't want to be associated with George House Trust and, you know, HIV. In 2 months' time, that person, you'll see them in a social space. So that alone is a change.
I had a lot of people come and saw us, and they are in tears or they are shaky, and the way they come out smiling and sharing the problem and value the person as a person.
George House Trust has really helped me to go through it and gain back my confidence and my life back.
The prognosis for somebody diagnosed positive today in the UK is a very, very good one, and we should never lose sight of that. Somebody living with HIV is the same person today as they were before they were diagnosed, and should have the same hopes and aspirations as I would, as you would, or as they had before.
We change life, and we give hope.